Hey folks, welcome to the Paindora Podcast. I am your host, Dr. Kevin, and I'm here with my co-host, Dr. Melissa Katie. And for today's episode, we want to talk about trauma and healthcare, and not necessarily in the way that you may be thinking. So Dr. Katie, how are you today?
I'm good. I had, speaking of trauma and healthcare, I might as well bring up the example we were discussing earlier, is that sometimes, when you work in the healthcare system, you can be in certain environments where, there's a lot of stress in the sense of just keeping things moving and also worrying for your patient's safety. And unfortunately, sometimes you can be in toxic environments where you're not supported in your advocacy for patients. And I had the privilege and benefit of being supported, which was such a relief because it does not happen everywhere. And anyone who is in the healthcare field knows what I'm talking about. But when you're trying to do the right thing for patients and you feel like you're getting the beat down and just hearing an earful by people that don't understand the stress that you're under and what you're trying to look out for, when people don't understand that, it can just make your job a lot worse, and it can feel pretty helpless and hopeless, and can help with the incidence of burnout's one word for it, but there's a lot of different words being thrown out there, and moral injury is another one, and just this idea of, and we'll have to refer to the podcast that Dr. Kevin did not too long ago, talking about this sense of ability to have control over the situations, and also this sense of responsibility towards patients. And it was really a humbling experience to, after so long, at times feeling like I'm in environments where no one's really, there to support you and make you feel like there's other people other than you that want to stand up to things that are right. It was just a wonderful experience to have that, despite the stress that I was under, and to give some sense that you're not going to be walked all over when you're already stressed out. So, I think whenever you have a physician or a nurse or anybody trying to take care of patients and they're already stressed and already time crunched, you need to feel like you have the voice to be able to make a difference and do the right thing over and over. Otherwise, it's going to be really hard to stay in the field. And if you're a victim of the system, it's really, unfortunately, patients become a victim of that as well. Any thoughts?
Oh, many thoughts, many thoughts. The first one I just want to clarify. So I think the top podcast we were talking about was when I was a guest on Doctors Unbound with Dr. Dave Drakinas, right? Okay. So, and we'll try to put like a look in there. That was actually a great episode for me to do, and I was really privileged to talk to Dr. Dave about that, because it was just a lot of fun. So Doctors Unbound, great podcast. It's really geared toward physicians, but it was an interesting experience. Yeah, so much kind of unpack there. I'm going to kind of go from the back because there's a couple words that you said, and the one of them is the idea of, I guess, this may lead into a different discussion than we want to go into, but the idea of victimhood, right? And when it comes to healthcare, and specifically like physicians in the healthcare system, there is a lot of stress, trauma, burnout, moral injury, whatever we want to call it. But I also want to emphasize is the fact that to be a victim, you actually have to assume that role. And so we have way, way, way more control than people recognize. And I think, though, developing that sense of control over what it is that you provide, because nobody else can provide what we do. I mean, we can't. And this is not being cocky about being a doctor or anything. If anybody, I go after the doctors all the time, but it's just to say we have a skill set that's pretty unique. And so we as physicians, and really as healthcare clinicians in general, need to recognize that we provide an important service. And if the system outside us can continue to winnow down and constrain us and put us in these environments where it becomes very, very difficult to do the right thing, that is not a great environment to be in. I can understand when you are and when you may have to navigate it. But at some point, we need to recognize that we do have the strength and we do have the control, and we can choose to do something else. And so I just want to kind of lie that at the end, because the one part would be we sit there and we're going, oh, woe is me, the healthcare, and we can't do anything. but we active choice, like the ability to kind of take control of your choices again and recognize that you do have a choice. They may not be easy choices, they not great choices, but you have that ability to choose. And just being aware and able to recognize that is super crucial when it comes to burnout and moral injury or whatever. And the ability to distinguish yourself, that you aren't a victim, that you are a survivor, or that you have more agency and you can do things to really transform both your life and the environment that you're in. So I kind of went a little bit off topic there.
Mm-hmm.
On the trauma standpoint though, and I think what's important for our audience, because we have this kind of general audience, I'm assuming, who's whoever's crazy enough to listen to us, what you need to recognize, multiple pieces. One, you need to recognize that when you are under stress, you have a difficult time communicating. Just think about any time in your life when you have had so many overwhelming things going on. Maybe you are, fighting with your spouse, or your kids are acting up, or you're having financial difficulties. And you just think about in those instances, very, very difficult to make good decisions. In fact, it's very difficult to make decisions at all. And so when you're under that stress, your vision tends to narrow to the short-term behaviors, and you start to see a lot of threats, even when threats that aren't even there. That becomes very difficult to make long-term good decisions. Now, interestingly, and we had talked about this before we got on, is systems, meaning organizations, workplace environments and things, start to react in the same ways that humans do under significant distress. So when you look at a healthcare system, of which I have not seen one yet, that is not under significant distress, they act in the same way that a person would, meaning the organization doesn't make good choices. They can't think long-term. Individual departments start to silo off and to be very protective of their role, and they don't want to share information with anybody else. Communication starts to break down. People become empowered on what they can't do. I can't do this. I can't do. So we hear lots of no's, and less about trying to, well, how could I help you? Or how could I make this work? Or how could I facilitate this change? And that becomes important as a consumer, because you have to recognize when you are stepping into these environments, you have to be your own advocate. It is not that they're bad people or horrible, awful people in healthcare. Sure they are, they're the minority. But in a system like that, if you want to take care of yourself, you have to make sure that you're keeping your head above water and you are not kind of falling into that trauma environment and being able to say, you know what, this is not the greatest interaction. Maybe that doctor was short with me, but what was the good information that he said? What are the critical questions that I need answered for my care, and focus on getting those answered rather than just, getting into arguments or long, not being able to talk effectively, writing this stuff down. So, it's important to be aware of that environment so that you can go into it. You're kind of, you're stepping into the lion's den. You're aware that there are lions in there, but you can get through it safely as long as you know that it is not a happy place. It's not a happy rainbow place, unfortunately.
Right. Yeah, and to jump back regarding those choices, I think it's really important to recognize that there are times when it's usually one of the most difficult decisions. It's sometimes in our lives, whether you're a professional or not, and you recognize that there's something toxic in your life, a relationship, an environment, the way you're living your life, whatever it is, sometimes it requires actually changing your life. And I think this is a perfect, podcast with both of us on here, that we both made intentional choices to avoid the toxicity and to avoid a life that brought us more stress because of how we viewed healthcare and how we want to take care of patients or do good for the world. Even for me, I'll speak for myself, leaving after my pain fellowship, chose not to do any pain injections and struggled with the idea of how to create a sustainable business without those injections. And also made the intentional choice. I even wrote down a number of what was the minimum amount of money that I could survive on and live on and I'd be happy with. And I wrote that down, and I started working 2 to 3 days a week as a physician, lived in a little 600 square foot apartment. I didn't have these high expectations of grandeur and everything. I have never worked full time on any extended basis. And I think intuitively, I just knew that for the sanity and for my own just life, that why do we have to live by these rules of 5 days a week and be forced in this, forced in this hole where you have to get on the hamster wheel, however you want to like create this analogy. But I did not want to be part of that. It actually made me feel stressed before I even did it. So, for me, I think having a choice is definitely important. And what I brought up with my example, I do have a choice whether or not I work in certain environments. And there is always that chance that I'm going to step into that. And you are right that we have to value ourselves in a way that's beyond sometimes what we give ourselves. And I'll speak for myself. Sometimes that part of that is having boundaries. And I don't want to stereotype, but as females, sometimes we're really guilty of not setting boundaries. And we are in a world that, predominantly was male, driven before, the last 50 years. It's changed, or 100 years, it's changed tremendously. And so there's definitely, we have to make a conscious effort to recognize our value and to set boundaries if that's not something that you've always been the best at. But I mean, I'd like to hear what you think about that, or the choices you made to.
Well, I think you did some really smart things that I think a lot of people miss, right? Is you recognized early on that there was a problem. And then instead of sort of spiraling, well, what am I going to do? What am I going to do? You started developing a course of action. And the important things about a course of action is you say, what is it that I need? Like, what's that minimum level that I will be comfortable with? And certainly when it comes to, I think, healthcare, and particularly with physicians, and in the extended time that we have been through, university, medical school, residency training, where you're mortgaging over a decade of time and living, it not only do you come up with the loans, but there's this kind of, people want to go out and just buy a house to get the new car and somehow start living this doctor's life, and you hamstring yourself. Because when it comes to making good choices, you also have to make sure that you can proceed with. I'm not ever going to say that you can't make your choices, but it becomes much more difficult when you have $600,000 of debt and 2 mortgages on top of that, plus whatever. And then you can still make a choice, but it becomes much more harder on the execution. Yes. And so very early on, the fact that you said, well, this is what I need. This is the minimum. This is where my happy place is. Anything above that is great. That's a great technique. And you don't have to be a physician to do that. Anybody in any life is, what is important? What is your minimal standard that is something that you're happy with? You don't need to go out and eat every day. You don't need to, different types of vacations. What's important to you? You don't have to go spend thousands and thousands of dollars staying in the Ritz-Carlton. What are those key things that make a difference for you? Recognizing where they sit, and then designing your life around that, rather than sort of falling into this trap of more and more and more and more and more. And then, because that's that we call the hedonic treadmill, where you start thinking, well, it's the new car is going to be better. The new house is going to be better. The middle-aged people, or certainly the new wife, is going to be better. And it isn't. You acclimate to it and nothing changes, especially if you haven't made some of those value-based choices of what it is that you want. Where is it you're going to deliver value? How is it that you're going to make a difference? So I applaud you for those, that you did that early on. I mean, thanks. I had the mortgage. I had the 2 mortgages.
I have a mortgage now, but
it was a struggle.
But I luckily bought low in Austin and got a nice size house for like the same price that if you bought a tiny house in Austin, it would have still been the same price, now, as I, bought a decent sized house then. So I don't feel so guilty. But I'll just put it this way. I would never buy my house right now. I mean, Austin is like gone through the roof when it comes to the value of homes now.
Wait for the next real estate crash. Total different topic, but
yeah.
So, but from a stress standpoint, what are we trying to say here is, if you're a physician, clinician, or whatever, is to recognize that you have more agency than you think. I know I talked about this on other podcasts and things, but it is so crucial to understand that we can make good choices. You know, they may not be the most profitable choices, but if they're aligned with your values, they're the right choices for you to make. So much of healthcare, looking at our traumatized healthcare system, you get people in later positions that are also like, I am firmly convinced, because I should say this, I don't think they'll be watching this, but I'm firmly convinced that healthcare CEOs are the most overpaid, underperforming chief executives in any sort of business industry. There may be one worse than that, I'm not sure. Because I'm familiar and I've met a lot of different CEOs in different different industries. And they're like amazing dynamic people doing super cool, creative things and caring and mission driven. And then you come back to healthcare and these guys are making, you know, you look at these nonprofit healthcare systems with 1, 2, 3, 4, 5 million plus salaries going to their CEOs, stock options for the people who are in the health insurance industry. And what do they have? They have the worst product on the market that doesn't serve, who's their customer? Who is it that they're supposed to be providing value to? It's not the patient. If it was the patient, we would not be paying more for our healthcare system than anywhere else in the world, with having pretty atrocious outcomes, some of the worst in the world when it comes to outcomes. So anyway, I forgot where I was going with that.
Yeah, I'd love to see a CEO give up a bigger chunk of their salary to go back to those that are not getting their needs met in healthcare.
Yeah, here's a point on this, right? So again, healthcare under trauma, nobody's aligning as we're moving through this period of transition where we're trying to do value-based care, which I'm actually I'm a proponent of. I actually believe in that. You should be being paid on value, and we should be doing things or not doing things based on long-term evidence-based value, not quick profitability or our views that the AMA RUT committee sets up. And yet, like I can tell you locally, and you may probably have an example. Actually, I know a couple different examples of this. The hospital or the health system isn't making enough money. And then they start hiring freezes, which is dumb when it comes to everybody who's providing care. So they're not getting more people to provide care. Well, that's kind of like your income generator.
Yeah.
And is dangerous, and you're stressing people out. And then you're going to lose people. Now you're shrinking your workforce. They stop salaries or stop bonus structures on, again. So now you have people who are already stressed out, and then you put an additional financial stressor on them. But I have yet to see someone in the C-suite voluntarily cut their salary in the same way. I've never seen that. On the other, different industry, new startup, well, almost a different country, I would say. Healthcare CEO, again, different country, doing really amazing dynamic things, trying to change a model of care to create a value-based, we're going to do the right thing, evidence-based driven. And when they struggle, voluntary, not only did they cap their salary to begin with, halved their salary when they were going through financial difficulties. That is a leader. That is someone who's trying to make a difference. And you don't see that in American healthcare. I just don't see these, from a values driven standpoint, from the C-suite, the big decision makers for the system standpoint. And if they're not going to make it, if you're below them and you're the physician, then you need to be actually willing to make those value-based decisions. Because then they can't do what you do. They don't have our skill sets. And there's, outside of this episode, there's a lot of potential we have in healthcare that we can have innovation and change, that we can actually start working and caring for patients and providing healthcare rather than sick care. But I don't think we're going to see it in our traditional healthcare system.
Yeah, I think to kind of tie into a few things, I think the system itself is squeezing the soul and the spirit of humanity and how we're trying to deliver compassionate care to patients. And when you start doing that, it has this, it takes a lot of the joy out of it for both sides. And even if the C-suite is still making the same amount of money, it's especially when they're not giving back, when they're financially struggling, apparently, on the other side of things. And when you don't really take care of those who are working through blood, sweat, and tears, literally, you're going to put a constraint on their capacity to be able to give back to their own family when they get home, to take care of themselves so they can give more to the patients. You start squeezing out the creativity within healthcare, and it ends up being this same monotonous, just toxic environment that so many people are struggling with, that want to just jump out. And that's a dangerous place for us to be in this country. But it also is a huge opportunity for us to make radical change. You know, I'm a little bit pessimistic because I think there's too many wheels turning that are financially benefiting from this, aka the middlemen.
I don't think you're pessimistic. I think you're realistic.
Yeah, that too. Pragmatic.
Pragmatic.
But there is the capacity and the possibility and the potential, but it's going to take a huge falling on our face.
I say there's going to be lots of crashing and burning, and when we start hearing lots of wailing and gnashing of teeth, maybe we'll start getting somewhere. Because you're exactly right. There's so much blood sucking going on that people, not only just in the hospital and with groups and low value care, but all these other little side industries that are kind of, PBMs when it comes to pharmaceutical management, just sucking, just that provide absolutely no value to the system. And the only thing that they do is basically, how can I benefit me as this little entity here?
Yeah.
It's disgusting.
Yeah. I don't like to talk politics or anything like that, but medicine and politics have something in common, and that there's a lot of money involved, and there are some people that are not, I don't know the right adjective at this moment, but they're just some not good players.
Many not good players. There's so much selfishness that's rampant in it. When you have, the Academy of whatever specialty, and I'm not going to pick on them specifically, that are presenting at a conference and saying, you know what, we just created this subdivision that's going to do research. And the reason we're doing this research is because we need to be able to show to the insurance companies that we've done research saying that what we do works, so that they'll pay us. Right there, you have set the foundation for something that's not only illegitimate, but harmful. Because now you're not designing studies to see whether or not treatment effects are true or whether your therapy actually is beneficial to your patient, but you're setting up your intervention in such a way that the only results you're going to publish are ones that are beneficial to you, the deliverer of care. And that harms patients. And that happens all the time. I mean, that's another one. It is absolutely shocking how much research is being produced. And the point of that research isn't actually to see whether we're helping patients, but to justify some stupid intervention that's $20,000 and it's got 50 million in venture-backed funds behind it. I mean,
I call those pocket advocates.
Yeah, pocket advocates. Yeah, exactly. Yeah, pocket advocates.
Not patient advocate.
Not patient advocates.
Yeah, no, it's a disservice to our country, and of all places, like you said. I mean, there should be no reason for this kind of stuff happening, but there's every reason when it comes to the dollar that people are not doing it. So I think it like you said, it's going to take a huge, it's going to need to be a massive overhaul of some sort, but it's going to get bad before it gets better.
It is going to get worse. And the other part, because again, I don't ever want people to come from this podcast going, oh, everything's doom and gloom, there's nothing you can do. The great thing about it is if you actually understand your health, just a little bit of learning there is so much that you can do. This idea, we've had 20, 30 years now where people have been taught that their bodies are frail, that everything that you have is a disease. Every sort of symptom that you possibly can have is a disease. Anytime your stomach starts twirling around, it must be something bad. And lo and behold, if we tell you it's bad and you focus your attention on it's bad and you have all this negative connotations, fine, it gets pretty bad over time. But that's not true. Your body is remarkably resilient. You are stronger than you think you are. The point of the healthcare system is not to find what is wrong with you, but is to eliminate, or at least to diagnose what isn't. What am I trying to say here? Is to eliminate the possibilities that is clinical suspicion. So you go in, you're not asking, they're not to tell you what's wrong with you per se. What they are to do is tell you what it isn't wrong with you, meaning you don't have cancer, you don't have a horrible infection, you don't have some horrible autoimmune process. In the absence of those really big bad things, your body is amazing. Mm-hmm. And if we step back and we just feed it and we move it and we sleep it and we keep it away from those toxins, it can do so much more than we give it credit for. And really the modern healthcare system is not designed to do that. So little education, you dip your toe into the raging river of healthcare. You say, I'm not feeling good. I need reinsurance from my primary care doc to make sure I don't have horrible, awful things. And that's a good thing. If they tell you and say, hey, I know you're hurting, I know you feel horrible, but I want to just reassure you that you don't have these are the things I wanted to make sure you don't have, and you don't have them. You're gonna be okay. It just takes some time, and as long as you move and eat and do all these nice things, you know, we just have to. Once you do that, and once you can kind of recognize how remarkable our bodies is, healthcare becomes easy, and so you have a choice of stepping out. Now, the kind of circling back here, the danger of healthcare and these toxic environments that we're creating, though, is it's not like a restaurant where you have a bad owner who's yelling at the cooks and the wait staff, where as you traumatize your staff and you have a traumatized restaurant environment, the food quality goes down and people then stop going to that because they have a choice.
Yes.
In healthcare, we don't have that choice because at some point in time, and I mean, you're going to have to step in. You don't have a choice in whether, well, I guess you could, but if you have something and you're freaking
you really
out,
need it.
A heart attack, if you have crushing chest pain, you're going to enter that healthcare system. And so ultimately these environments that we've created, we have a captured audience, a captured consumer that we're doing this complete disservice to because we're not fixing our own crap. And we're not fixing it because we're making money off of it, or someone's making money off of it. And I just can't think of anything more abhorrent than that.
Yeah. Yeah. And I think we have to, I know, Dr. Kevin and I both know that there's a lot of well-intentioned practitioners or clinicians out there that are trying to do really good work in a very constrained system that can be toxic. And unfortunately, sometimes even that constriction that's put on those clinicians in those environments, they sometimes can focus, despite their good intentions, may focus on telling you what you can't do, and you have this. And we know that instills a lot of fear and a lack of belief in the system and the body to change. Now, there are some, it's hard to give people perspective without a full medical background to like delineate which things are really important and which aren't, but that's the whole point. Knowledge doesn't mean anything if you don't have perspective. So that's why Google doesn't work well if you don't have good perspective. I've seen that happen on a few occasions to patients that really don't fully get the whole picture of the body. But the point is that if you can rule out the important things, sometimes unwittingly, a clinician or a physician can tell you, well, you shouldn't squat. Like I've heard these things, like you shouldn't squat. You got some degeneration in your knees. And I'm like, so that means I can't go to the bathroom. Like, they don't even think about what they're saying. It's like, okay, there's different gradations of effort, and maybe we need to modify. So just because it hurts when you do something, you could find other ways of moving. Not necessarily you have to avoid it. Sometimes you do need to gently work through it and let your body know you're not harming yourself. But there are ways to make your body feel less concerned. And at some point, if it's a new injury, if it's an injury, it'll heal. I'm dealing with a family member right now, trying to make them believe in their bodies. I mean, that's amazing. I have to say that, but they're so impatient. And the funny thing is, it's not funny. The more you show concern and the more you keep going back, even though they gave you, reassurance, it's nothing major, they can't help themselves but do something more to you or give you something else. And there's this delicate balance of okay, we can reassess it, but it depends on how much fear and concern you have. People will do more to you the more you show up. So I'm not saying don't go to your clinician, but there is this balance of, okay, we know there's nothing major going on. You're not spiking 104-degree fever and it's healing. It looks red, but it doesn't mean, it's, you're going to get septic and die. So it's just all those nuances. I think just reminding people that the body, like you said, is amazing, but sometimes we can put limitations on patients out of fear or lack of understanding, think we're doing well by the patient, but you never know how that person's really interpreting it and how they'll live the rest of their life based on what you say.
Or mistaking sympathy with compassion.
Yeah. Oh, explain that.
Okay, so, I know I did this, so I know I did this, but I've seen some really horrendous examples of it. Also is when you come in and someone's hurting, and rather than providing compassionate care, we provide sympathetic care. And what I mean is you see people come in and it's like, oh my God, I can't believe how bad you're doing. And I'm just so amazed, that you're still working because your back, it looks so horrible on x-rays. It's just amazing that you're even moving, because I know people that would be writhing on the ground if they had that. And that implants this, it's like, oh my God, I must be really bad. The doctor's like this. Or even worse, this pisses me off, where you have the surgeons that know it's not a good case, but rather than saying, you know what, this is not the right case and this is not the right therapy for you, they say, you are so messed up, I don't know where to operate, so I don't recommend an operation at all. And you're like, well, what the hell are you trying? And specifically, the person I'm thinking of, it was told this. It was, they're even in fact talking to a spine surgeon, which is this whole other beast by itself. But the spine surgeon, at least they didn't operate on him. Instead, they said, your back is so bad looking, there's nowhere I could operate on it. And it's like, well, what have you now done who walked into your office without any sort of assistive devices? What have you implanted in this person, thinking that their spine is this disintegrating mess, which it isn't. Again, the back is one of the strongest structures of the body. So these, in other ones, we use this nocebo, the opposite of placebo, the harmful language that we use, where you're telling people like, how are you doing? And they're like, oh, they're checking in with their patient. Their patient had something, they came in, and the physician reaches out. Good doctor practice, following up. Maybe you're going to call them. Maybe you're going to see how they're doing. So you call them up or you message them, how are you doing? And the patient says, I'm doing really well. Thank you for seeing me. I'm taking the medication. And then they go, well, that's great. I hope the medication doesn't stop working and you get worse. And there's an example I've heard of that. And it's just like, what the hell are you thinking you're doing?
Yeah.
With that kind of languaging. And with someone at risk who's already kind of unsure maybe of what their body's, and this is the one thing that I think we forget to appreciate, is after all of our medical education, we at least have an understanding of what this beautiful machine does. A lot of people don't do that. And we certainly aren't educating people well. I don't know what they're teaching people in health class. I don't think they teach normal physiology anymore. But this can be this mystery machine where little buzzings and sensations, and this becomes, oh, what did the commercial tell me? What did the commercial tell me? Yeah. And so we have people who are unsure and uncertain, and then we're throwing that kind of negative language on it, which is nonsense language also. Just the language that we use that can be so potentially harmful. But I also, again, to return this back to the topic of trauma, it becomes easier to do that when you're in an environment under distress, where you're now, even the practitioner is narrowed down. So all they're seeing is danger and threat, potential danger, all that, rather than
or getting sued.
Or getting sued. Yeah. I think that's a whole different topic.
Yeah, that's another topic.
It's a whole other topic on the lawsuit thing.
Yeah.
But,
well, anyway. I think, and I'm sure we've gone on a little longer than usual, but one last thing I'll say is that even a physician I talk to, it's amazing. It even takes sometimes physicians who've been trained to, and I'll say that, I don't like to say the human body is a machine, because I don't like people to correlate it to a car, because we're so adaptable, and you and I both know that.
Yeah.
But I just ran into a physician who literally said, hey, by the way, because he knows I do pain stuff and education and empowering people, and he said, oh, I hurt myself on my knee, and then I had hurt my abdomen, and I did this and that, and people wanted to operate on me, and you won't believe it, got better when I did this and that, and And I'm hearing a physician say this.
Yeah.
So it's like people they just somehow, the moment you feel the pain, the moment you feel like it can't change, you go into this like, it's never going to change and I can't do this. And if you just give yourself a little bit of space to explore it, and after you find out there's nothing like emergent, and you give it time and you start believing in your body again, your world opens right back up.
Yep. Yeah.
And it's pretty awesome. And once you experience it, you start believing it again. Easier to believe again.
It is easier to believe it. And again, so you bring up another important point though, because I'm thinking about that is you have there's almost like there's two different physicians. There are the physicians that are like, this is, recognize this danger to the system. And then there's physicians, like you said, that fall right into it. Like I can think of two people specifically that are physicians, and one of them's getting whittled on all the time. Mm-hmm. Like, I'm like, what is wrong with you? Oh, my hip hurts. I'm going to get a hip arthroscopy. I'm going to get one on the other side. I'm going to get my shoulder looked at. I mean, all these vague musculoskeletal stuff, and they're getting surgery after surgery after surgery after surgery. Mm-hmm. And I'm just like, well, how? I mean, what is it going to
take to wake up?
To wake up, because you have such there are physicians that have this idea, that this so strict biomechanical viewpoint, like
dogmatic, maybe.
Well, no. I think it's dogmatic, but it's biomechanical. That somehow have drank in their own Kool-Aid. That we have way more, like, that we can do more to the body than we actually can do.
Yeah.
And somehow these poking a little thing and looking and shaving off pieces of bone is going to do better than what your body can naturally do. I mean, it's just it is quite shocking. I don't think there are not as many of them, but there are quite a few doctors that have drank the Kool-Aid.
No, I had taken care of one in particular. Can't say any details, but I know at least had 14, maybe 15 to 20 different pain procedures, and it was like so hard for me to bite my tongue because of my situation at that time. And I just like.
We talked about John Bonica, didn't we?
We brought him up. Yeah.
Okay. Well, father of pain medicine, 22 orthopedic surgeries, and uncountable interventional procedures performed, and still never got better.
Right.
And you're like, okay, well, well, if the father of pain medicine was so ingrained in his biomechanical viewpoint, but started us on this catastrophic.
He had to stay in pain to stay. I don't know. To still be his own patient. That's horrible. I shouldn't say that. He was probably I didn't know him personally, but from an anatomical standpoint, probably really good at labeling all the stuff, and
Well, and the one thing I pick on him a lot, because I do think he's responsible for a lot of harm in this world. But it's like that, that saying of the road to hell is paved with good intentions.
Yeah.
Well, good intentions was he thought that pain was something that we needed to be more cognizant of, and we did, and we do need to be more, and we still do. And it's important. I mean, obviously I'm biased and you're biased, but understanding pain provides a foundation for good health. That pain skills are life skills, and you will, no matter who you are, you're going to face pain in your life. So why don't we have a little bit of knowledge around it so that you have the skills and you're prepared to face it? And so awareness of that is great, but he just flipped on this path of, pain pus oozy, whatever, that every pain must be oozy. He didn't, obviously, he didn't even understand gate control when it came out. Like, he bastardized that first theory and quickly went to this idea of the pain receptors, pain pathways, all the stuff that Melzek and Wall were saying we don't have, even as far back as 1965. And I think it just came to his belief that because he was a pro wrestler, right? And so he had all this physical trauma, and he wanted to equate this idea that physical trauma equaled all this other pain for the rest of his life. Well, you can't replace your body. And again, your body is a remarkable healer.
Yeah.
And he didn't recognize all those other elements, because I'd be very curious to hear the rest of the story. That was, what else was occurring in his mouth? What else happened in his childhood? Where was he raised? The fact that he must not have been from a wealthy family, because he had to work his way through medical school as a pro wrestler. And what what kind of impact did his home environment have at that time? Early life stresses and things. So anyway, that's
and how he lived day to day. So
how he lived day to day.
Well, considering we've talked about trauma and this idea of constriction on the system, and sometimes it impacts patients. Well, it definitely has an impact on patients. And We want to really empower patients and clinicians to make wise choices for their own health and wellness, especially when it comes to pain. And that you have to recognize the environment you're in and see it for what it is. And even though this may seem like a tough place we are in medicine right now, there is still a lot of control that patients have for their quality of life. And they have to recognize that sometimes the system can help them and sometimes the system can harm them. And recognizing that can take some time. And sometimes, it takes maybe getting a few opinions. The question is what kind of opinions you're getting. That's a tough one.
That's the other hard part. Yeah.
So trying to guide people in the right direction is tough. But I just want, and I think you too, want people to be not anti-physician or anti-medicine, but just to be wary of that medicine is not there to live your life. And you have a responsibility and the ability to live your life in a healthy way. And all you can do is try to find those clinicians that are deeply caring despite the system and despite how it's constricting them, maybe not in the best of ways. So from the Paindora Podcast, Dr. Kevin and myself, Dr. Katie, look forward to talking to you again. And until then, Dr. Kevin?
Stay well, folks.